Welcome everyone. Happy New Year. It's good to see everyone back again. I'm Barb Link. I'm with Superior Health Quality Alliance, and this is our 5th session of our Tele-Echo on fundamentals of a culture of continuous quality improvement. Today's session is using tools and charts, part 2. And we just want to make a few announcements here. We have one more session left next week. We're still looking for case presenters. So if anyone has any issue or intervention process that you're concerned about and would like to present that to the group for feedback and Q&A, we're happy to have those. So please do so. You can always provide that information. We'll provide you the form. It's very easy to fill out, and we can walk you through it as well. You can always talk to us further. If you're interested, just email me, blink@mpro.org, or elena@esmith@mpro.org, and we'll talk further about it. So today, we have our agenda will include our participant introductions, our didactic presentation from Elena on using tools and charts, part 2, and then we will have a case presentation and discussion. And so we did not receive one from any of the participants, so Elena drew up a very nice mock presentation today, and she'll be presenting on a health system and developing a process for COVID-19 vaccination and implementation. And it sounds like one of our participants received her vaccine, so hopefully she might have some input on that. Just some general reminders. All sessions are recorded, and we always want to see you. So if you do have video capabilities, please turn that on. It just provides a more interactive experience for us all. We ask that everyone make a practice of chatting in your name and your organization in the chat box when you join, so we can just record attendance. It's also helpful for us if you could revise your name. It looks like most people know how to do this now in the video gallery by clicking on the 3 dots that are in the upper right-hand corner of your thumbnail, and just click rename and type in your name and your organization so we know who you are on an ongoing basis. We want to remind you to mute yourself when you're not speaking and unmute yourself when you are participating, and just state your name when you have a question or want to provide some feedback during today's session. Please, just as always a reminder, do not disclose any PHI or personal health information during these sessions. And if you have any trouble with Zoom, please just go to the chat box, and our technical specialist, Elena, will help you out. And then if you have any other questions or comments, I'm the clinic coordinator for today, Barb Link. So just chat me anything, and I'll be monitoring chat throughout the session and can address any questions or any input that you have as you're doing that. So next, I think the easiest thing for us to do to keep on time is, if anyone is new to the session today, we always appreciate you unmuting yourself and introducing yourself today, and then saying what organization you're from. So at a quick look, I'm not seeing anyone new, but anybody new to this session today or has not participated before? Okay, all right, great. So then I will just reintroduce myself, and then we'll get going to the didactic presentation for today. I'm Barb Link. I am one of the quality associates with Superior Health Quality Alliance, and I am located in Detroit, Michigan, just outside in Farmington Hills. And we work with the states of Minnesota and Wisconsin as well through Superior Health. and my coworker, Elena Smith, who is the technical specialist today and doing the didactic presentation. Elena, you just want to say hello?
Hello, everyone. I'm also located in Metro Detroit along with Barb, but you'll definitely see some of our other coworkers in the other 2 states throughout the many different offerings we'll have throughout the next few years.
So with that, if you please would remember to mute yourself when you are not speaking, and then unmute yourself when you have a question. And throughout the presentation, if you do have any questions or have any input on today's didactic presentation, please chat it in and we'll get to that at the end of the presentation. So today's didactic presentation again is the Using Tools and Resources Part 2. Last week was a great presentation and now Elena will be supplementing that with more information on tools and resources. And Elena from Superior Health Quality Alliance will be providing that. If you have any other questions or want further information, please chat it in and we will address it at the end of the presentation. So with that, Elena, would you like to take over?
Yeah, thanks, Barb. I will share my screen. Okay. So as Barb mentioned, welcome to Fundamentals for a Culture of Continuous Improvement, Session 5, where we'll have a continuation of what we kind of talked about last week or 2 weeks ago on utilizing tools and charts. So today's objectives are to understand how to utilize a histogram and kind of the different shapes you might see within a histogram, learn how to utilize a cause and effect diagram, and then using those cause and effect diagrams to use a scatter diagram. So that's what we'll be focused on today. So the first one we're going to jump into is a histogram or a frequency plot, and these can be used interchangeably. So these are similar to the Pareto chart from last session, but instead of multiple variables, histograms or frequency plots are bar charts for one variable. So you'll remember from that Pareto chart, that would be something that maybe you're surveying your staff to find out reasons, for example, why they might not get a COVID-19 vaccine. And then you would chart them by, okay, this answer got the most, all the way down to the answer that got the least. So that's what the Pareto chart would help you identify where to focus your energy on those answers that have the most frequency. For this, you're not going to have those multiple different variables. You just have one variable like weight. So organizing weights by frequency. So showing, not organizing them by frequency, but organizing your weights on the x-axis and then your frequency on the y-axis. So these are used to visualize a central location, shape, and spread of the data. And you only want to use this when you have a stable process. So we kind of talked a little bit about stable processes and we talked about run charts a few weeks ago. So these, you'd want to make sure that your process is stable when you are utilizing a histogram. You do need 25 or more data points to really gather anything from a histogram. And it's always important to note the shape and spread of the data displayed in the histogram. When you want to use these to find patterns in the data, to show the data's shape, which we'll get into in the next couple of slides. So when might you use these? During COVID-19, maybe you're going to use them to visualize frequency of COVID-19 infections in certain age groups. So again, you would have the age groups down on the x-axis, and then on the y-axis, you would have the frequency of COVID-19 infections. Maybe you're going to use them to visualize the number of employees getting the COVID-19 vaccine by age group. Again, that would be that similar x-axis and y-axis. After COVID-19, maybe you're going to utilize this to visualize the frequency of the amount of time it takes to get patient medications passed each morning, or visualize waiting time for getting admitted or being seen. Now, when you're constructing a histogram, you need to split the data into intervals. For example, if you're looking at age groups, maybe your groups will be by 10 years of age. So 0 to 9, 10 to 19, 20 to 29, etc. And then you want to look at the frequency of cases within those age groups, and that's how you construct your histogram. You may need to alter how you split the data into the intervals based on how your histogram turns out, but I'll get into that in the next couple of slides to show you how you'd be able to identify that that's happening. So this is an example of a histogram. So this one is focused on the frequency of specific weights. Not sure exactly, I couldn't think of an exact reason you might use this one, but this one shows you that the weights are at the bottom and how often you're seeing those weights maybe in your patient population. The next thing is our histogram distribution shapes. So this normal distribution is probably something you're pretty familiar with. This is that bell-shaped curve. It has an even distribution on each side of the average. So you can see there that you have right in the middle, the highest frequency, and it goes down pretty equally on each side. The next thing that you might find is a skewed distribution, and this is asymmetrical. The peak is off center and a tail stretches away from it. Now you can tell if it's right skewed or left skewed based on where that tail falls. So this one you can see is right skewed because you have that longer tail on the right-hand side. The next one that you might see is a double peaked distribution shape, and this looks like the back of a two-humped camel, and it's also called a bimodal distribution. And this is the result of two processes with different distributions. So what you might find, you might see this if you are looking at a whole day and seeing the differences between the day shift and the night shift. Maybe there's some changes there, and that would be evidence of that. The next one is a plateau distribution. This is the result of several processes with normal distributions combined. Many peaks that are close together that resemble a plateau. The last two distribution shapes for histograms are an edge peak distribution, and this is like a normal distribution with a tail. So you can see, you see that bell-shaped curve, but then over on that right-hand side, there is a little bump at the end. And this can often be seen when there's a group labeled greater than or less than in the data you're looking at. So you can see in this edge peak distribution over here on the right, that has that bump on the right, that one would have that greater than option. So if you flipped this, that peak at the edge was on the left-hand side, that would be when you have a less than situation. So if you're, again, looking at those ages in relation to COVID infections and you just have 75 plus at the end, you'd probably see that little peak there because you have that greater than option. And then the last one is comb distribution, which brings us back to how you're splitting up your variable. So these bars alternate between tall and short, and they could be a result of not using the correct measurement. So maybe your measurement is either too wide or too small, and is creating this comb distribution where if you changed your interval up a little bit, you'd see more of a normal distribution without those small and tall bars in between. So if you do find this when you're mapping out a histogram, you may want to revisit how you made those intervals. Maybe that 10-year age difference needs to be changed a little bit if you're seeing this. So the next thing I'm going to talk about are cause and effect diagrams, which can also be called fishbone diagrams or Ishikawa diagrams. So I'm going to call them cause and effect throughout this portion of the presentation. So these are used when you're brainstorming to organize ideas around problems and the potential causes. So they display possible cause and effects. These are a great way to identify where you want to start with improvement projects. So mapping this all out and then checking things off. So to start, you want to identify your problem. Then you're going to identify at least 4 potential categories of causes, and then start that brainstorming process where you look for potential causes that fit into those categories that you just identified. So the next slide is going to show that a little bit better. So on this one, we're looking at long test results time. And these people identified 5 different categories. They identified environment, people, equipment, methods, and materials. And then within those, they sat down as a group and brainstormed some categories, some causes that would fit in those categories. So we see that under environment, they looked at maybe the clocks are inaccurate or don't agree. Within methods, they looked at too many people being involved and having unnecessary steps. Within lab supplies, maybe they're unavailable or spoiled. So kind of where you can go from there is you have this nice cause and effect diagram, and you look at it and you identify things that maybe you believe are the top issue. And you start with that and you make the changes. And then if that doesn't really create a big difference in your long test results time, maybe you're going to meet a different one of these and change, for example, the clocks. You're going to go around your whole facility and make sure every single clock is on the right time. So you've narrowed that out of being what's the problem. So you can kind of go through this until you kind of find that root cause. But this is a great way to just map everything out and get everyone on the same page of what could be causing this. So when might you use this? During COVID-19, maybe one of your problems is that staff is calling in for shifts more often than they were before. So then you'd sit down and you look at some potential causes. Maybe it's because they're getting sick, or maybe it's because they don't have childcare anymore and the schools aren't in session. So you can kind of identify some ways that maybe you can help with those things. Another problem maybe is increased number of COVID-19 cases in staff members. Maybe this is an education problem, or maybe it's a PPE issue, and kind of working on some of those things. After COVID-19, maybe your problem is an increased number of falls, and maybe you're seeing that that's happening more often when there is a high number of staff calling in, or the call lights aren't working properly or something like that. Maybe another problem, like we just went over, is that long test results time. So all of those things are just a good way to map, all of cause and effect diagrams are a good way to map out these types of problems and then start your quality improvement processes on the things that you've identified. Which then brings us to scatter diagrams or scatter plots. Now these evaluate possible cause and effect, and we've all heard of probably that statement that correlation does not equal causation. But we can use those causes and problems identified in the cause and effect diagrams that we just went over and scatter and plot them out on a scatter diagram or scatter plot. Now these are used to test whether the performance of one factor is related to the performance of another. And you do need paired samples, which can be kind of the difficult part of this. One sample goes on the x-axis and the other goes on the y-axis. So here are some ideas of when to use a scatter plot. The number of daily COVID-19 cases in your county versus the number of daily COVID-19 cases in your organization. Maybe you want to see if you're seeing that relationship, that as that's going up in your county, that you're seeing it kind of go up in your organization as well. The number of daily COVID-19 cases in your county versus the amount of PPE used per day, and just kind of mapping that all out. And as you see that kind of raising in the county number, okay, we need to start getting prepared that we're going to be using more PPE. After COVID-19, maybe you're going to look at the level of satisfaction, of patient satisfaction versus the length of time spent with the provider, or the number of falls per day versus the number of staff member call-ins. So once you start plotting these things, you might see a couple different things. The first is positive correlation. And before I get into this, positive correlation does not signify good or bad. It just means that as one of the variables starts to increase, there's a correlation that shows the other does too. So for a positive correlation, the data points go from the lower left corner of the chart to the upper right corner of the chart. You can have stronger or weaker positive correlation based on how spread out the data points are from each other. The tighter the data points are, the stronger the relationship. The looser the data points are, the weaker the relationship. And then the more outliers you see on this chart, the weaker the relationship. So based on all of that, a perfect positive correlation would show a straight line of data points. So this one looks pretty strong. It could definitely be stronger, but you definitely see that very distinct line that's going from the lower left-hand corner to the upper right-hand corner. The next is negative correlation. And again, negative correlation does not signify good or bad. It just means that as one of the variables, for example, the y-axis, starts to decrease, there's a correlation that shows the other increases. So for this one, you have data points that go from the upper left of the chart to the lower right of the chart. You can have stronger or weaker negative correlation again, based on how spread out the data points are from each other. And a perfect negative correlation would show a straight line of data points. So this one you can kind of see is probably not as strong as that positive correlation, but there are some pretty tight data points in there. And then the last one is no correlation. So with this one, there's no clear pattern of the data points, so there's no real relationship identified. So you can really see that here. We don't see any form of a line showing up on this. The data points are kind of all over the place, and you can really see that difference between the negative, positive, and no correlation. So with that, that's all I have for today. I have some resources available here to look into each one of these things a little bit more. But I will hand it back over to Barb to introduce the case presentation, unless anyone has any questions.
Yeah. Thank you so much, Elena. Anybody have any questions about the information Elena presented today? Now it looks like Julie is off mute. I don't know if you have anything in particular you wanted to say. We're getting feedback that it was a nice presentation. That's nice. It was very good. Okay, and always we'll have time at the end of the session as well if anybody has any questions they want clarified or anything like that too. So at this point, yes, we will move on to the case presentation for today. So yeah, Elena came up with a great and very timely presentation about a health system needing some information and guidance on their protocols and implementation of immunizing staff. So Elena, and again, just a few reminders. Elena will present the case. I'll do a quick summary of it, and then we'll ask for clarifying questions from the group. And then after that, look at some recommendations that the group may have for the presentation. Okay, so Elena, if you want to get started.
Thanks, Barb. So yes, my name's Elena, and I am presenting on behalf of Superior Health System. So this is a mock presentation, but please feel free to ask any questions. So my plan is to create a vaccination plan. So I'm going to work with an interdisciplinary team to develop a plan for vaccinating our staff. We will start by vaccinating those in the COVID ICU and emergency department, and then do a lottery for all other staff members who have patient-facing positions. So physicians, RNs, MAs, registration staff, housekeeping, etc. After all patient-facing staff members who choose to be vaccinated receive the first dose, we'll begin a lottery for those in non-patient-facing positions like billing and administration to get vaccinated. Simultaneously, we will be encouraging those that opt out of getting vaccinated to get vaccinated using staff testimonials. We're considering a survey to ask staff why they got vaccinated to create a campaign surrounding their answers. We'll also educate staff on the importance of reporting any vaccine reactions or symptoms post-vaccine to our vaccine team, and by utilizing the vSafe app. We will also continue to watch for additional success stories to share with staff members over time. For those that opt out of receiving the vaccination when offered, we would like to send them a survey to ask why, to see how we can focus our education. So as I mentioned, we have an interdisciplinary team. So I'm a QI manager, but we have a nurse, a physician, a pharmacist, a medical assistant, someone that's in administration, someone from housekeeping, someone from scheduling, a registration staff member, and a billing staff member, all on our team, so that we can really identify some apprehension that people might be having around the vaccine in those different areas. So we have a goal of vaccinating 500 staff members per day. So we will monitor that closely and place it on a run chart each day. We anticipate some challenges. So we aren't sure about the number of staff members that will opt out of getting the vaccination. We want to have a solid plan in place to encourage staff to get the vaccine. We will also need to be extremely organized in ensuring that staff members are scheduled correctly to get their second dose at the appropriate time and to be prepared in case staff members have symptoms after either dose. We're also struggling with what to do if staff members are symptomatic on a day that they are scheduled to work. Should they be forced to use their paid time off? And what if they don't have enough? We are concerned with dealing with all of the aspects that kind of surround that. So our next plan is that we will create a survey for both those being vaccinated and those opting out and begin vaccinating our COVID ICU and emergency department. Some things that might help or hinder these changes. We are limited on time because we want to start rolling this out as soon as possible. So we need to move quickly to get our staff vaccinated. We also want to be proactive in our staffing choices to ensure we aren't left short-staffed. So the specific help I'm seeking from the group today includes, what are your vaccination plans at your organizations? What are your plans for encouraging those apprehensive about vaccination to get vaccinated? How are you staffing your facilities after vaccination? And is there anything I'm missing in my plan that could help this become more of a success?
Great. Oops. Thanks, Elena. So just to give a quick summary, today's case presentation focused on developing a process for staff at a health system to receive COVID-19 vaccines. So planning for which departments would receive the vaccine first, how to address staff members that opt out of receiving the vaccine, and a plan for staff education on the importance of being vaccinated were some of the highlights of this particular presentation. Does anybody need anything clarified? First, we'd like to start with just people reviewing and needing any, asking Elena just any specifics that might be helpful. Anybody have any specific questions? Yeah, Joanne.
Yes, I'm just curious. I'm not real familiar with the priority for vaccination, but I know healthcare workers are high on the list. But when you're saying individuals that are not seeing patients, so, account payable or whatever, accountants, those types of things, do those fall under the healthcare category, or would they be someone similar to me who is more removed from patient care? So I guess my question is, are all workers within the system considered high priority, even if they're not face-to-face with patients?
I think that's a great question. So again, we aren't in the health system, so hopefully maybe there's somebody else that maybe knows that a little bit better. I'm stepping out of my case presenter role, but I have heard from some people that there have been some people, I think, in some of the non-patient facing roles that have definitely gotten vaccinated. I also know that there's definitely some flexibility in those phases because we don't want to waste any doses, and we definitely want to get the population vaccinated. So there could be, I think, some of that involved as well, because each vial contains a large number of doses and you have to use each vial within a certain amount of time. So I think there probably are some systems that are going to be able to move through their entire system with the vaccines that they were given. But I don't know if anyone else has any insight on that, because I'm definitely not an expert and I have not been involved in any system-wide vaccination process.
I have heard that Julie from Beaumont might have some input on that. Can you unmute yourself, Julie?
Yes, I'm sorry. What was the question?
Thanks. Okay.
Yeah, I think the question was, for those larger systems, are they able to utilize kind of their vaccine supply that they've gotten for those non-patient facing positions? that kind of sums it up a little bit, I think.
Right now, there depends on who you ask. Within our system, they are looking at expanding it and have offered for all employees at different levels in the organization. But I have had some challenges. For example, in our COVID clinic here at the vaccination clinic here at the building yesterday, we were given information from the association that we were able to vaccinate family members of hospice residents because they're coming into the building. And I've now been told by Region 2 North that we're not able to do that, and that it's supposed to be only direct care health workers that are getting the vaccination right now at level 1. So it seems to be there's still a little bit of conflict or needing further clarification at the state level, and that's kind of bounced back to the state level with our feedback from yesterday. So that's a long answer to a short question.
No, but understandable, because it seems like that's kind of what's going on right now. But
well, because realistically, we can only run the health system with so many positions vacant. So at some point, we have to start to fan it out to support services, because they do support the clinical care delivery. You know what I mean? We don't run just with clinical care delivery.
Yeah.
Like somebody has to pay the bills in order for clinical care delivery people to keep doing what they do. So
Absolutely.
Beaumont opened it up to all employees, but I can't really, I just have a little bit of pushback at our level from some of our support service state and federal entities.
But that's helpful.
Yeah, great question too.
Okay. We have had a few other recommendations come in through the chat. Do you have an infection prevention person available for your group? That would always be helpful for figuring out priorities and rolling out. And
definitely. I think we might look at our infectious disease physician to join that group to help with that.
And Kim also sent me something that we'll make sure we send out to the group, an informational piece on informing staff decisions to take the vaccine. Is that correct, Kim? That's the resource you sent?
Yes, it is, Barb.
Great. So we'll make sure everybody gets that as well. And Mythbusters, make an informed decision to all our staff. That was from Kim. So we'll make sure everybody gets that as well. That'll be very helpful. Great. Okay. Has anyone faced any of those decisions or had to do any education around staff that are apprehensive or tentative about getting the vaccine? In any ways that you've addressed that as of yet? Or any plans or thoughts that you have in anticipation of that? We've got the information there. So usually Mythbusters, I hope the healthcare profession is supportive of this, but sometimes people have thoughts or backgrounds that it makes them very tentative about these sort of things, even in the healthcare profession. So anybody had to address that or deal with that yet? This is
Julie, again, I'll go out on a limb.
sure. Thank you, Julie.
Long-term
Thanks.
care is not known for participation in flu vaccines for as long as I've been in the business, which is 30 plus years, until health systems required it as a continued employment. Now we achieve 100% flu vaccine, and staff are very reluctant, and I think if anybody watches the news nationally, long-term care staff are reluctant to take the vaccine. So, you know, we started with leadership and talking about it and so on and so forth, but it's turnout has been not as strong as what we had hoped for our first vaccine session. I know people are commenting today, they're watching to see those of us that took it yesterday how we do, and that maybe they'll consider for the second session. We have 3 sessions. So if you get the vaccine on the first one, you get your second dose on the second one. But since there's a third one, you could get your first dose on visit 2 and your second dose on visit 3. So we're hoping to increase participation through the experience that the people had in the first set. So it's a big problem.
Yeah.
Getting
Thanks for
people
that
to
input. Yeah. But I think you made a lot of the suggestions that even we talked about in earlier sessions about leadership buy-in and support, consistent messaging. Hopefully people believe the science, and having certain people stepping up and taking the first round. And if other people need to see how those people do with it, then, you know, so be it. Hopefully that will reinforce it as well.
You
I
might
see a
be
few-
surprised to know that we also have reluctance from family members to authorize us to vaccinate nursing home residents, that was unexpected for us.
Yeah.
So we don't
Goodness.
even have 100% authorization from that particular group. So it's beyond just the staff. At any rate, we'll keep working on it.
Yeah.
Barb, I wanted to add to what Julie was sharing. This is Kim. We, as part of the messaging system, you know, we have to send those weekly messages to families. We updated that to go beyond the required messaging and included some information on the upcoming vaccine clinics. And then if those messages needed to be sent more frequently, we added, you know, so far we've received consents from, you know, this many residents and staff. This is not yet close enough to achieve community immunity. We ask you to consider blah, blah, blah. So just kind of reinforcing that message frequently.
Great. Great. Thanks, Kim. Thanks, Julie. Thank you both. Quite a few people are chatting in here. Lauren from Maple Grove Hospital. I'm not directly involved at my organization, but I believe we're going to look at what departments or areas that have low vaccination rates and target them for the conversation. Great. And Kim provided that AHCA member site leaders in other areas of the country use their medical directors to host education sessions for staff and respond to questions and have a Q&A period afterwards. Great. Thanks, Kim. Natalie from CMCOA said no discussion yet, but we've not provided, but they don't provide direct care. They're a council on aging. All services are being done via phone or virtually right now. And then Kim, again, the sites with the medical director involvement have received 95% resident vaccination and 80% staff vaccination. Great, Kim, that really speaks to, again, the importance of leadership and supporting the effort. If they're doing it, then lots of times people, if it's a trusted leader, they follow along. And then Kim, let's see, Karen said we did a survey prior to receiving our allotment. And for those who did not want to take the vaccine, we asked what type of education and from whom might encourage them to get the vaccine. And some wanted, let's see, sorry, I've got to scroll here. And my mouse is acting a little funny. So, some wanted to hear from our local providers most. So that's really great. And again, that's the type of education, trying to really talk to the people who are tentative and figure out who would they respect most. And it could be maybe one of their coworkers. It might be the medical director, but this time it might be if a fellow nurse, just like Julie and Kim gave the example, took it and did just fine with it. Maybe that's the person they need to hear it from. Andrea from North Memorial said share resources from CDC and MDH. That's, I'm thinking the Minnesota Department of Health there, on priority for team members to get vaccines. At North Memorial Health, we refer to these sites and they're posted there, and we'll make sure everybody gets those as well afterwards. And Natalie from the Central Minnesota Council on Aging said it's helpful information when we do have the discussion with our leadership team and staff. So she appreciated all the information that we're talking about today. Okay, great.
I just wanted to share like something that I've seen. So I used to work at actually a Beaumont emergency department. And so I'm still Facebook friends with some of them. And I saw one of the nurse practitioners was doing something every couple of days, must be just after her shift, that she was going on Facebook and writing 40-year-old female, which is like herself with Pfizer vaccine, this many days after the vaccine, no symptoms. And she had a group of people that she worked with that were telling her this information that she was serving. And she went in and she was posting what each of them, if they had any symptoms, all of that, what they were that day. And it seemed like it was being pretty effective in the comments of that Facebook post, but I could just see that being pretty effective. If you find someone that works within your facility that's respected, that could be a champion for this, that is agreed to get vaccinated. Like you kind of said, that people are looking to see what's happening with those that are getting vaccinated. And if they're open to sharing that information, or if you have some kind of board in a staff room where people might pop that information up on a board to say, here's how many days I am post-vaccine, I have no symptoms. Maybe that could be a driver to get others to feel more comfortable with it as well. So I think that as always, you know some of your staff members that are champions, that are well respected, and kind of getting their buy-in and having them share things with others is a great way to encourage other people to kind of follow suit and feel more comfortable with it. Yeah, and I see Kim wrote, please weigh the benefits of being vaccinated against the risk of testing positive with COVID as part of the messaging.
Yeah.
Have there been any conversations? Another one of my questions was, have there been any conversations about scheduling? Because we do, and I know Kim just wrote this in there, the concern about the second dose. From what I've seen, there have been some fevers and things like that, like the day after you get the second dose. So I was just wondering kind of if there have been plans in place at any of your facilities about scheduling and maybe how to schedule people so that maybe they don't work the day after they get the vaccine or the 2 days after they get the vaccine in case they do have some form of a reaction.
This is Julie. We'll be looking at that for the second dose, just based on how some of the people felt today after the first dose. So we'll be looking at a little bit of a different plan for the second dose.
Yeah.
Although we did tell people not to share that they didn't feel well, so that they would make the vaccine reluctant people not give them any more reason not to take it.
Yeah. And I've heard kind of two sides to that, which I think probably depends on kind of your overall knowledge of vaccines too, is that some people, they want to have some form of a response after they get vaccinated to show that it's making some kind of change in your body, that you're having a response to it. But obviously there's probably far more others that don't want to see any symptoms after getting vaccinated. So, and I know Kim just put in the chat, a concern we may want to plan for is after the effects from the second dose. I have heard to expect a higher personal impact post-vaccine for my physician As staff check with other vaccinated staff to see how they are doing post-vaccine, they should not consider higher effects from the second dose to be a flag. It gets us to 95% immunity. I see some questions in the chat as well. I've heard questions about if someone already had COVID, then gets the vaccine. Any negative reactions? Is it necessary to get vaccinated if someone already had COVID? The answer to that is yes. I'm going to post some good, so the ACIP, which is escaping me, right? This Advisory Committee on Immunization Practices, they hosted after the Pfizer vaccine, or kind of the day before the Pfizer vaccine emergency use authorization was approved, and then the date that it happened, they hosted several hour-long meetings where Pfizer went through their whole clinical trial and explained kind of things that Kim was just talking about, where after that second dose, you can expect probably a more of immune response, like a fever and achiness and all of that. And they also did kind of the same exact thing for the Moderna vaccine. So I'm going to post where you can find that information so you can look through that yourself and kind of get all of those details. But yeah, they definitely explained in both of those that even if you've already gotten COVID in the past, they only expect you to probably have that immunity for about 3 months. So they're hopeful that this vaccine will extend that immunity much longer. So they definitely still suggest that even if you've had COVID, you should get the vaccine. If you wanted to wait potentially after you're outside of that 90 days after you had it, like if you just got it today, you probably will have that 3 months worth of immunity. But there's no harm in getting it like after you're clear. So they definitely recommend you to get the COVID vaccine, even if you've already had COVID. So I'm gonna find those links to those slides so you can look through all of them yourself and see what information is presented there based on what vaccine you'll have access to.
And somebody just wanted to make sure that we provide all the links. I think it was Kim, and all the information we're talking about. Yes, everything that we talk about or post in the chat is in the follow-up email that we send out to everyone as well, along with the slides and case presentation information. So we'll make sure you get all of that as well.
I'll put that, the overall link that has a ton of different information on it that I can kind of narrow down into the things that might be providing the most amount of information that's useful to you, I'll kind of pull out, but this website has all of those links. But again, I'll kind of pull out what I think could be most useful to all of you because there's a lot of information. I did sit on most of these calls, so they're super beneficial, I thought, and really explain things very well. And I didn't, in regard to Anna's question, I didn't see anything specifically that said for anyone that already had COVID and then gets the vaccine if they have negative reactions. I didn't see anything specific to that in any of the clinical trial information that's included in those links that I posted.
Well, we've got about 10 minutes left, but this has been, Elena, that was a very timely presentation and it generated a great discussion. I think it was very helpful. I know a lot of people are rolling things out right now, have been doing, vaccinations for COVID-19 right now. And so I think it was very helpful. And yes, we will make sure that the presentation from today and all of the discussion points and links that we talked about will go out in our follow-up email as well. So just checking to see if there's anything else in chat.
So I got one. Do you have recommendations for when to use each style of data presentation other than Fishbone? So Kim, do you want to get a little bit more specific?
Well, at Beaumont, we might use a control chart if we have a long series of data that we're really trying to hone in on a problem area. But I wondered for the different things we've seen over the last two sessions, if it's pick something you're comfortable with, or if there's actually a recommended time and place, you know, other than just the type of data that would drive you to one of those formats.
Yeah, I think that's a really good question. And maybe that's something I can kind of include in the last session, in the first few minutes of that last session, to kind of look at some other ideas of when to use those specific charts that I went over. Because I think that's a great question, like kind of here's what they are, but when can I utilize them? So I can kind of get into that a little bit more and do a summation of some ideas that might drive some other ideas.
I appreciate that. Thanks.
Yeah.
Great question. Okay. All right, well, I just want to thank everyone today, welcoming in the new year with some data discussion and vaccine discussion. A very helpful presentation today, as well as a lot of insight. And, you know, I would wish that everyone would want to get vaccinated, but I guess I do understand some people's tentativeness. Yet, you know, I was watching the news this morning and saw a gentleman on a ventilator just saying, I didn't wear a mask because I thought it was political, and now I am so sorry. And he was one of the people that I don't want to, but I would assume he would be someone who wouldn't wear a mask, and now he's on a ventilator and he is pleading with people to follow those protocols. I'm sure I'm speaking to the choir, but it was very effective, at least for me to see that. And I hope that it generated for some of those people who are still feeling that this isn't a good thing to do, or not getting a vaccine, that they see the opposite end of it, and that they think that it is important, not only for themselves, but for their family members and the community to take care of themselves and get vaccinated now that we have that opportunity, and continue with all of the protocols that seem very simple to do, not invasive at all. Washing your hands and wearing a mask and doing social distancing and wearing gloves when appropriate and those sort of things. So it was a very good conversation. We will make sure that you get the resources. We really, again, the group has got wonderful resources and insight, and that's exactly the whole philosophy around ECHO. So we really appreciate that, and we'll make sure everyone gets those resources from today. And we will follow up on the recommendations and provide that information as well to everyone. Our next session is on January 12th at the same time, and you should have the Zoom link in your calendar invite when you accepted the initial one and registered. If you have any issues, just reach out to Elena or I, and we will make sure that you get the calendar invite updated. Sometimes there are some glitches with Zoom, as everyone knows, but for the most part, it works very well. Our last session is on continuous learning and education. Elena will follow up on some of those suggestions on how to use some of the information and data points that she talked about today. And we will also still look for one last case presentation if anybody has anything that they would like to present. Again, very simple and generates great discussion and lots of resources. So please, if you have anything that you'd like to talk about, we're more than happy to talk that through with you and help you out present that case. We've had some wonderful ones this session. Again, we just really appreciate everything. We appreciate your time, your contribution, and your participation, and everything that you're doing for all the patients across our region. So thank you so much, and we look forward to seeing you next Tuesday. All right, goodbye, everyone.